For this video, we will be explaining tests that you can do to see if a person has a rotator cuff injury. The rotator cuff is a group of tendons and muscles in the shoulder connecting the upper arm, which is the humerus, to the shoulder blade, the scapula. The rotator cuff tendons provide stability to the shoulder. The muscles allow the shoulder to rotate. The muscles in the rotator cuff include the teres minor, infraspinatus, supraspinatus, and the subscapularis. Each muscle of the rotator cuff inserts at the scapula and has a tendon that attaches to the humerus. Together, the tendons and other tissues form a cuff around the humerus. This is a picture of rotator cuff. Here's the capsular ligament, the humerus, and then the tendon, the subscapularis and the infraspinatus, and the teres minor, and then both the supraspinatus. In humor, this is the posterior view and the anterior view. The first test that you can do for rotator cuff injuries in the shoulder is an empty can test. You will take the patient's arm about 90 degrees abducted away from the body. You will have it also 30 degrees forward. You will have the patient internally rotate their arm like they are emptying a can out. That's the name of the test. And then you will put a downward force on the arm. If there is pain or any wincing coming from the patient, then the test is positive. The second test is a drop arm test. The patient will abduct their arm 90 degrees away from the body. The trainer will let go of the arm and see if it can stay on its own. If the patient can hold their arm up, then the test is negative. The last test is Yergason's test. You will keep your elbow against your body and have your forearm 90 degrees. The trainer will take the arm and externally rotate it. If there's pain or popping noise coming from the rotator cuff area, the test is positive. The empty can test is considered positive if there is a significant pain or weakness. Pain alone is less accurate than actual weakness, especially when the arm is tested in full can position, which is 45 degrees of external rotation, as pain can be a result of supraspinatus tendinitis or other injured or inflamed structures. Weakness can be the result of a tear in the supraspinatus muscle or tendon, but can also be the result of pain-induced inhibition. Pain is usually felt by the subacromial region, but can sometimes be felt in the upper arm. For the drop arm test, elevating your arm in the scapular plane is a natural movement of the shoulder that places the proximal and distal attachments of the supraspinatus muscle along a straight line. If there is injury to the supraspinatus muscle, the glenohumeral stabilizers will not be able to support the arm, and it will either drop suddenly or the patient will have complaints of pain. For the Yergason's test, it is considered positive if pain is reproduced in the bicipital groove during the test.